Okay, good afternoon, everyone. So thank you again for joining today's session. My name is Moise. I'm the peer support lead at the HopeSpring Cancer Support Center. I lead the peer support program offering support for cancer patients and caregivers. So today's session will be exploring ways to manage lymphedema. Okay. So before we actually get into the content of today's session, so I'd like to hear from everyone who has registered so far. So if you can start with your name, give a little brief background about yourself, and what is your relationship with cancer? Let us know what are some of your hobbies, indoors or outdoors. Anyone can take the lead, you know.
Oh, how does this work? Share content?
My name is Sonia,
Mhm.
and
Sonia?
I'm a breast cancer survivor. And hobbies, reading, walking. Somebody else's turn.
Reading and walking. Interesting. Thank you, Sonia. Okay.
Okay. My name is Alice, and I had breast cancer, and the hobbies are birding, Tai Chi, quilting. Keeps me busy.
Great. Sounds interesting. Okay. Anyone else?
I can go. My name is Amanda. I don't know if Catherine, my relationship to cancer is that I'm a new lymphedema therapist, and I'm here to learn from to learn more information from Catherine. And I'm just kind of gobbling up all the resources that I can since I've received my certification, and that's why I'm here today.
Great, great. Amazing. Okay, who would
All
like to
right.
go next? Yep.
Can you hear me?
Yeah, we can hear you.
All right, perfect. So my name is Becca, and I'm just starting my breast cancer journey. I've just completed 2 chemo treatments. I'm a gardener by profession. I've got 6 kids, 4 stepchildren, 2 of my own, and I'm just navigating how to do this as a family.
Great, great. Thank you. And I think there's Vicky. Would you like to go next, Vicky?
Hi, can you hear me?
Oh, yeah, we can hear you. Okay.
Okay, great. I am a breast cancer survivor. I have been treated by Catherine for the past year for lymphedema in my breast, and it has helped a lot. So I'm just here to see if there's any more tips and tricks that I haven't picked up yet. And my hobbies, I guess, are reading, crafts, cooking, traveling with my husband, and getting ready for Christmas, I guess.
Great. Thank you. I think that's everybody. And Catherine, if you'd like to go and briefly introduce yourself.
Absolutely.
Yeah.
So all my friends call me Kathy, so please call me Kathy. I'm a registered nurse, registered massage therapist, and a lymphedema therapist. I have been helping people with lymphedema since 2006. So if I do my math right, that would be around 17 years. And my hobbies, well, I spend a lot of time in front of my computer and in front of a book, so reading, and I do like walking as well. I have a treadmill, and since the colder weather has started, I dusted it off, but I should be doing more exercise than I'm doing.
Great. Okay, thank you so much. And I think there's also Nahilia. Would you like to introduce yourself, Nahilia?
Hi there. I don't have my camera on, but my name is Noelia, and I am a staff member here at HopeSpring. I'm the Member Services Programming and Volunteer Lead. I've had several family members, extended family members, who had unfortunately had cancer. Some of them have passed away, and some of them are with us. And one of my hobbies I love is to go swimming.
Great, it's exciting. Okay, so thanks so much everyone for giving those introductions. So we can continue with the session. So I'll start off with a brief introduction on the topic of lymphedema, just to kind of give you an idea of, just a brief idea of what lymphedema is, and you know, the lymphatic system and all of that. Just a brief introduction, and then of course Kathy can get in more in depth with the topic. Okay, so the lymphatic system is part of your immune system. Okay, so it protects your body from foreign invaders, and that causes illness. And it maintains fluid levels throughout your body and absorbs nutrients and fats, and removes waste from the cells, right? So as a filter for the fluid that flows through your cells and tissues, lymph nodes are organs that clean up and get rid of lymphatic fluid, waste, and invaders that cause illness. Okay. So lymphedema refers to tissue swelling caused by accumulation of protein-rich fluid that usually drained throughout the body's lymphatic system. So it's most commonly affects the arms or legs, but can also occur in the chest wall, abdomen, and other areas of the body as well. Lymph nodes are an important part of your lymphatic system. Lymphedema can be caused by cancer treatments that remove or damage the lymph nodes. So any type of problem that blocks the drainage of lymph fluid can cause lymphedema, right? So when lymph fluid is not properly drained, it can cause swelling, and that's lymphedema. So lymphedema can affect the ability to move the affected limb and increase the risk of skin infections. So some treatments may include compression bandages, massage, careful skincare, and in some cases surgery to remove swollen tissue or to create new drainage routes. And of course, Kathy can go into more depth in this topic. Okay, so that's with that brief introduction, I'd like to kind of go back to our registrants, just to kind of have the opportunity to kind of share your own experiences with lymphedema, if you are a patient and if you have experienced lymphedema yourself. So do you or anyone you know have lymphedema, first of all? And if so, what are some symptoms that have been experienced? So anyone who knows someone or themselves, they have lymphedema?
Yes, I know someone who has lymphedema,
Sure.
and she is constantly wearing a compression on her arm.
Okay, that's one of the treatments that she's been recommended. Mm-hmm.
Yes.
Okay. Great. Anyone else?
I had a yoga instructor who experienced lymphedema, and it was being treated with compression sleeves. It was in her arms. But I personally haven't experienced it yet, but try to keep informed about it, knowledgeable about it, what to look for.
So again, a compression for the arms and sometimes for the legs as well. Okay. All right. And anyone else like to share anything for the first one, the first part? Okay, and for the second question, what are some treatments recommended to you or to someone else to manage lymphedema? Like you said, you use compression. So is there a treatment that works best for you in managing symptoms of lymphedema, or anyone that you know? How often do you undergo treatment, or someone you've spoken to manage those symptoms? And have they experienced any reductions in symptoms?
No.
I think so. Someone was saying something. Alice?
I personally do not have lymphedema,
Okay.
but with my Tai Chi, I'm hoping that this movement will help me a lot.
Great, great. Okay. And have you spoken to anyone with lymphedema who has, let's say, reduced their symptoms or managed to reduce their symptoms? And what is their strategy or way of doing that?
The only person that I found was the person that's wearing a compression sleeve,
Okay.
and that is constant.
Okay, so it's constantly on them, right?
Yes.
Compression sleeve. Okay. And is it helping with the reduction?
Yes. Yes, it is.
Okay, it's really good to hear. Okay. So thank you for those who shared those experiences. Of course, it's very important to learn about lymphedema, and those who we are taking care of, those who have lymphedema, can also learn more about how to better manage this condition. Okay. So I'd like to bring now Kathy with your presentation on the lymphedema and its management. Okay.
Okay.
So Kathy, I'll let you share the screen, share your slides.
Host disabled participant.
Oh, you can do it now.
Oh, there we go. All right. Here. Just bear with me here. All right. I don't know why, but I'm a little nervous today. So let me just do some deep breathing. So, first of all, I'd like to thank Moise and HopeSpring Cancer Support for having me here today, and also all of you that have joined me today. Today I'm going to focus on 4 key strategies for lymphedema maintenance that you may already be doing if you have lymphedema. And I'm here to actually explain why they're important and provide some answers to how you can do them. So first, a little disclaimer. The information in my presentation is meant for educational purposes, not to diagnose any medical condition or medical state. And always please consult your medical health professional before beginning any new lifestyle change. Also, I'm going to take you through a little bit of something that I do with every new person that I see. It's easy enough to say that, you know, lymphedema is a collection underneath the surface of the skin, but I'd like to give you just a little bit of an idea of how the lymphatic system works, what can cause disruption, and also a little bit about what can stimulate or help lymphatic flow. So I'm going to try and use my little pen here. So we have our blood circulation over here on the lower right of the screen, and our lymphatics are here in green. This picture is depicting what's going on underneath the surface of the skin. So if we look over at the blood circulation, you have your heart, and it pumps out fluid, blood, from the heart into smaller and smaller and smaller tubes, we'll say, until it gets to microscopic capillaries. Now, these capillaries feed every organ, every cell in your body. One side, it's kind of divided into 2. So one side has all the oxygen and nutrients. The other side picks up any waste gases. That's your venous side. So out of the one side comes oxygen, nutrients, fluid, proteins, everything that your cells need to live. your cells are going to use all of this and they're going to excrete wastes. Some of it will be in the form of gases, which the venous system will take up, such as carbon dioxide. It'll bring it back to the lungs, then back to the heart, and then back in circulation. So it's kind of a circuit, goes round and round. The lymphatic system picks up the majority of fluid and protein. It picks up wastes and anything that's not supposed to be there in the tissues, such as bacteria. And it starts out only about 4 millimeters underneath the surface of the skin. So it's very, very close to the surface of the skin. Starts out as little finger-like projections, and it forms like a spider web all over the skin surface. And these little finger-like projections will pick up the fluid and waste and basically garbage. So your lymphatic system is kind of a waste and water management system as well. So it'll pick up this fluid into the tiny tubes and bring it into larger tubes. Now, these larger tubes have muscles in them, and these muscles will contract at about 8 to 10 times per minute, so much less than your heart. And this is just when you're sitting being a couch potato, it'll just sort of slowly contract. Along the way, there is valves within sections of these tubes, and the valves help the fluid flow in one direction back to the bloodstream. So as it continues on, it'll go through a series of lymph nodes. Now, this is where your immune cells will get rid of any waste and garbage and bacteria, viruses. They're filled with white blood cells, natural killer cells, B cells, T cells, everything that is needed to take care of all of those unwanted particles. And a little bit of fluid will be returned through the little capillaries that are in there as well. So essentially, the lymph nodes filter the fluid and sort of sterilize it. And as it moves on, it will end up joining back into the bloodstream at a place where I call the main drain, and that's up at your neck, just in behind your collarbones. So what can damage the lymphatic system? So any trauma to the lymphatic system, so surgery and radiation will damage lymphatic tissues. Any kind of other trauma, severe burns. For cancer treatment, it's mostly surgery and radiation. Lymph node removal will take away the ability of that extra fluid removal, and it'll cause some congestion back up in the tissues. So essentially, when you have backup and lower flow, you will have an accumulation of mucky water underneath the surface of the skin. All that protein and all the cellular waste is going to build up in these spaces. And as the fluid gets bigger, that's when swelling occurs. So lymphedema is an accumulation of the fluid, protein, and waste in the tissues. And this picture at the bottom kind of depicts of what it's kind of my simulation of the murky water that's underneath the surface of the skin. It is a chronic, progressive condition of swelling. And researchers have found that there's always this sort of state of inflammation that's going on in there, because the body doesn't want the garbage there. It wants to get rid of it. So there's always a bit of inflammation occurring. It can occur anywhere in the body where there is a lymphatic flow disturbance. So in breast cancer, it can occur in the arm, in the hand, underneath the armpit region, around your surgical site, in the breast. But there, with other cancers, it can also occur in the head and neck, in the legs or the abdomen, as Moise was saying. There are approximately, 2017, the Canadian Lymphedema Framework took some information from US statistics and sort of brought that over to Canadian population. So they said that there's approximately 1 million Canadians living with lymphedema. Now, surprisingly, obesity seems to be a major causative factor, with cancer treatment being close behind. However, they do state there are many more Canadians that have lymphedema that have not been diagnosed yet. As lymphedema is a chronic progressive condition, it is manageable. Unfortunately, they haven't found a cure yet, but the sooner it can be caught, the better. So what's going on underneath the surface of the skin? So initially you have this lymphatic vessel disruption, and this causes the buildup of fluid and waste underneath the skin in the tissues, and inflammation as the body's trying to get rid of it and deal with it. This inflammation and the buildup of waste over time can cause changes in the skin and the tissue architecture or the structure of the skin. As the limb increases in size, as the swelling gets bigger, the limb can increase in size and become distorted in shape. And it, if not managed, some possible complications can be a interference with movement and mobility. Definitely some skin and underlying tissue changes. It can cause some discomfort and pain. It definitely increases your risk of infection because bacteria loves a warm, moist environment to live in and grow. And so it's a perfect opportunity for these bacteria to just go crazy. And so there is an increased risk for infection. And those are the physical possible sort of complications. But lymphedema also has a psychological, social, and economic side to it as well. So there are body image issues as far as having that higher limb size. There is a decrease in quality of life. Some people don't like to go out as much as they used to. They don't want to socialize because of their lymphedema. And the economic effects come into play with the purchasing of compression garments, which are not actually cheap, as well as getting treatment for lymphedema. So it puts a bit of a financial burden, but I have had clients in the past where they have been off work because of their lymphedema, and so that has put them in a bit of a financial strain as well. So the 4 key strategies for lymphedema are surround actually the 4 treatment methods that are used: skincare, compression, exercise, and lymphatic drainage massage. These are in no means am I presenting this in any sort of hierarchy. They are all important and they work well together. So the objectives, of course, go back to the actual cycle that goes on. We want to break that ongoing cycle, preventing buildup of fluids and increased congestion, thereby decreasing that inflammation and the risk of infection, preventing tissue changes, and reducing that limb size and making the shape of that limb less distorted. And all of that will then decrease and prevent more lymphatic vessel damage. So the first we're going to go through is skincare. So taking care of your skin encompasses taking care of it from both the inside and the outside. So first I'm going to go over some signs and symptoms. When you have all of that murky fluid underneath the surface of the skin, the oxygen and nutrients can't really do their job in providing what the skin needs. It gets visibly dry and flaky. It can crack. There may be pink or slightly warmer areas. And over time, the tissue will thicken as a natural process of the way the body is trying to deal with that fluid. It starts out very soft, and then it can feel like your dough, bread dough, and then eventually it gets harder and more scar-like. They call that fibrosis. And you can see some decrease in hair growth because the hair follicles are not getting the nutrition that they need. In later stages of lymphedema, their skin can become discolored. It can become lumpy and bumpy. And by that, I mean, it has little growths where it looks kind of like a cobblestone road. And if there is too much fluid underneath the surface of the skin, it will take the path of least resistance and start sort of leaking or weeping out from the skin itself. So, drinking plenty of water, eating a healthful diet, and reducing stress actually will help take care of your skin from the inside. Water is, I think they recommend somewhere between 8 and 10 cups of water a day. But water is used in the body for many chemical reactions. It's used as a transport medium for nutrients, vitamins, and minerals. And so when you don't drink enough, the body, the skin tissue isn't getting the nutrition it needs. Plus, water also helps keep the tissues under your skin. And what comes to mind to me is your fascia, which is a layer underneath the surface of the skin. It helps keep it plump. And therefore, the skin and tissues are plump as well. Eating a healthy diet, getting all of the vegetables through vegetables and fruits and whole grains, keeping away from sort of anti-inflammatory foods, things highly processed, what do you call those? Deep fried foods, can cause inflammation in the body. And we want to tone down as much as we can the inflammation in our body. As far as stress goes, it is a major factor for causing inflammation in the body as well. And so doing mindful exercises, meditation, exercises like your Tai Chi or Qigong, however you want to pronounce that, helps to decrease stress hormones in the body, which then helps reduce inflammation. So those are 3 things that you can keep in mind when it comes to taking care of your skin from the inside. From the outside, moisturizing your skin is very important. The skin itself has what they call a lower acid mantle, so it's more acidic. And the reason that is because it's part of protecting you from any bacteria that lands on your skin that's not supposed to be there. They don't like the acidic environment, those bacteria, so they will die off. With lymphedema, the skin acid mantle is disrupted. So using either lower pH or pH neutral lotions will help your skin not only plump up and give you moisture from the outside, but it will help the acid mantle and fending off those bacteria. So an example would be the Aveeno lotion, Cetaphil lotion, Vaseline Intensive Rescue lotion, or Eucerin. Cleansers, same thing. If you try and not use cleansers that have perfumes in them, because they can act as an irritant to the skin. An example of a cleanser that you could use would be Dove. And having dry and cracked skin can also increase your risk for infection because bacteria can get into those cracks. Other methods would be protecting from injury and sunburn. So using your sunscreen, or if you're out in the sun, keeping under a shaded tree, wearing hats. Protecting from injury, this is where you would wear gardening gloves when you're gardening. When you are doing dishes, you can wear dishwashing gloves. Anything you can do to prevent cuts and scrapes. And I know we can't always do that. So if you end up getting a scrape or a scratch, just keep it well cleansed, and just keep an eye on it. Don't let it get infected. Using professional nail care. So a lot of times if we do our nails, we can cut the cuticle. And so just being aware, if you're doing your own nails, to be very careful when you're cutting your nails. Particularly people with leg lymphedema, their toenails get very, very thick. Again, the nutrition is not getting to the nails, and so they tend to get thickened, and so nail care becomes a little bit more difficult with that. If you're wearing a compression garment, making sure it fits properly, but not only if you're not wearing a compression garment, having those bras that cut in. Remember, the lymphatics are very close to the surface of the skin. So if your bra is making red marks, it's probably to some extent slowing down lymphatic flow in that area. So proper fitting clothes, proper fitting shoes, and any accessories, jewelry. Try not to put a heavy purse on the arm of your at-risk limb if you don't have lymphedema, or if you do have lymphedema, just try and use the other arm if you can. Dry brushing, there's a lot of hype on the internet about dry brushing. They say it increases lymphatic flow. Research hasn't proven that yet, but it has been known to increase circulation. My suggestions would be to make sure that you're not brushing too deeply or too harshly in order to cause irritation to the skin, that it's very, very light on the surface, and that you're brushing in the direction sort of the flow back towards your heart. Please, if you're using a dry brush or even a loofah, make sure that you're cleaning it. Dead skin cells, bacteria can get into those bristles and can be a source of infection. So make sure you're cleaning it, and try and get one that has a softer bristles, the natural bristles. With hot tubs, so when I graduated 17 years ago, we were told, no hot tubs, not at all, because heat increases circulation, which increases the amount of fluid coming out of the bloodstream. And therefore, if the lymphatics can't take that fluid, then you'll get an increase in edema. So the thinking has changed over the years. Again, there's no research on this. The lymphedema gurus, I'm going to call them, the people I look up to, have said that as long as the temperature is close to body temperature, so 98 degrees, 100 degrees, but no more than that, you can spend some time. If you have if you're at risk for having lymphedema in your arm, or you have lymphedema in your arm, then keeping your arm out of the hot tub would probably be a good idea as well. Keeping in mind too that hot tubs can harbor bacteria as well. So make sure the hot tub, if you have one, is properly cleaned and brominated, chlorinated. It has the proper chemicals in it anyway. Let's see. Chest edema, again, it's going to be a test situation. If you want to go in, it's something you want to do, test it out. Try 5 minutes. If nothing, if you don't feel any more swelling happening, then try increasing your time. Just do increments of 5 minutes, because everybody reacts differently. If two people will not react the same, some will get swelling after 2 minutes in a hot tub, and others will not. So just be cautious about hot tubs. And while we're talking about hot tubs and chemicals, we'll go on to pools. So even salted pools and chlorinated pools, when you get out, make sure you rinse off your skin and get all of the chemicals off, just because it can irritate the skin, just like perfumed skincare products. Well, I spent a long time on that, didn't I? So increased risk of infection. The next slide deals with this. And, one of the pictures might be a bit startling to you. So just warning you right now. So cellulitis is a common infection associated with swelling underneath the surface of the skin. And it can actually start lymphedema, or it can happen if you have lymphedema. It's happened in both situations. So the signs and symptoms that you're going to be looking out for is that your skin is going to be red, ruby red. It's going to be hot. It's going to be painful, and there will probably be increased swelling. Other symptoms you could have are like flu-like symptoms. You could have chills, just not be feeling very well, just like you're going to get a flu. If you start with those flu-like symptoms, just have a check of your arm or leg, and just make sure that there's really no areas of concern there. So the top picture you will see, this person has a line that has been drawn. And if you see like a red spot beginning, you can draw that line. And if it sort of extends up past, is when you know that you're headed for the doctor for sure. This person down below actually didn't recognize her symptoms. And she ended up in the hospital needing IV antibiotics. So we want to catch this early. So remember your red flag symptoms: red hot, painful, and swelling. And if you see these, you can check with your family doctor if it's just beginning. Otherwise, head to your emergency room, because you most likely will need antibiotics.
Oh, that's right. That's what I had here.
And I don't mean to scare you with that, but it's something to just keep in the back of your mind. It's very important to recognize cellulitis early. So the second key factor is exercise. Exercise through research has been shown to improve cancer symptoms such as fatigue, and it improves quality of sleep, and it can elevate mood. One of the studies that I was reading about actually showed, they did a study, and what they found is that people who go through chemotherapy can actually, their body can be deconditioned. It can like add 10 years of aging onto them. And so that's a lot. So with deconditioning the muscles, so if you're not well and you are laying around, your muscles can get weaker. And so what they found is when their exercise group did the exercise, it really slowed down that deconditioning. So it helped muscle strength. Exercise also helps to restore range of motion. So after breast cancer surgery, scar tissue tends to, or it can, for some of us, decrease how much you can move your arm. And so exercise has been shown to help restore the range of motion faster. It also helps with weight management. Research is showing now that obesity, so a BMI over 30 is associated with a lymphedema risk. So obesity can be a causative factor for lymphedema. Exercise also improves immune cell activity and reduces inflammation in the body, which is what we really want to do. It increases blood flow. And so one of the studies I found that was interesting too is that they found with exercise and the increase in blood flow, more chemo got to the cancer site, and the tumors that the individuals had got smaller than those in the group that didn't exercise. Now, ethically, they couldn't work on humans, so they did this on mice. But it's promising research for exercise. Exercise also decreases the likelihood of someone having to either reduce their chemotherapy dose or take a break from chemotherapy. And in general, it is known to help heart and lung function. And it has also been shown not to make lymphedema worse, but through muscle contractions helps to improve lymph flow. So what they recommend during cancer treatment is a slow and easy start. They say to move more and sit less. The idea is to build up a program of about 30 minutes, 3 times a week, of more of an active exercise with muscle strengthening interspersed with those. It is best to start with a supervised activity, meaning under the care of a physiotherapist, or here in the Kitchener-Waterloo region, anyone who's going to the Cancer Center at Grand River Hospital can ask their oncologist for a referral to the University of Waterloo's WellFit program. It's a 12-week program that currently is funded, where you will be assessed by one of their kinesiologists, and they will start you on a program and help you build strength and stamina over those 12 weeks. And with exercise, the end goal then is to build up to what they recommend for everybody, which is the 150 plus minutes a week. That includes strength, flexibility, and aerobic components. But don't also forget the stress reduction practices. So deep breathing, Tai Chi, Qigong, they're all take care of not only strength, but flexibility. And that mindfulness component with those also takes care of the psychological aspect of lymphedema and stress reduction. So let's take a look at some of the exercises. I've just listed a few here. So there's exercises that'll help your cardiovascular and your lungs. So the aerobic exercises, the muscle strengthening exercises, stretching exercises, and some of these do both. So dancing, of course, is going to be aerobic and muscle strengthening, and so actually is walking. I didn't put it in there, but yes, it will. The lymphatic exercises, basically, it's muscle contraction that you need to improve lymphatic flow. So pick an exercise that you love doing and do it. 2 things that you can add in is deep diaphragmatic breathing. So for those of you that have done yoga, you might be familiar with this. And it's just doing the belly breathing, or those who sing also. It is just taking a nice big deep breath. You have one hand on your chest, you have one hand on your tummy. And when you take that big deep breath in, your hand on your tummy rises, And when you exhale or breathe out, it goes back down again. When you're doing this, you visualize the air flowing right into the bottom of your lungs, pushing that hand out. And you get a nice, big, deep breath in. This stimulates the lymphatic flow of the deeper lymphatics in the abdomen, as well as lymphatic flow of the chest as the rib cage moves out and back again. The other exercises you can add in that I've listed on the bottom here will help pump the lymph nodes. So your lymph nodes in the picture on the right, your major groupings are in the groin, deep abdomen, in the armpits, and around the neck region. So any exercises you do that help to pump those, it could simply include neck side bends or neck rotations, looking over your shoulder shrugs and rolls. And you can actually take your hand and put it under your armpit and pump the lymph nodes in that region. For those that have had lymph nodes removed in the armpit region, it varies. We have about 50 or so. Everybody's different. So if you've had 10, 12 removed, there's still some there that you can activate. So elbow bends also for arms, the deep breathing I went through, core exercises. So those for your deep abdomen, those would be maybe little tummy crunches, just holding or Kegel exercises. It will help with the core, and you can talk to any physiotherapist and they'll give you some core exercises as well. For the legs, it would be knee to shoulder movements or knee bends or even ankle pumps, anything to get the muscles contracting near those lymph nodes. And I want to take one extra second here and talk about the benefits of pool. I think it's my number one go-to if I'm going to suggest an exercise, because it has twofold effect. The water has compressive properties. The deeper the water, the more compression. So it's acting like a compression sleeve. It's going to force fluid from a higher compression at the deeper part of the pool to a lower pressure. So if you have your arm with your hands facing the bottom of the pool, then the compression of the water will help force fluid up from your wrist and hand up towards the top of your shoulder. Plus, if you're doing exercises in the pool, you're also helping that by doing muscle contraction, and muscle contractions help squeeze and pump the lymph fluid up and out of there. So I recommend Aquafit to a lot of people. Not necessarily laps in the pool because you're just on the surface, but the Aquafit, doing the exercises with your hands mostly pointing towards the bottom of the pool. So compression is the number one go-to for treatment of lymphedema because it fulfills all the objectives of the lymphedema maintenance. It decreases tissue congestion, and through that prevents infection. It also, through that, promotes healthy skin and tissue, and promotes a healthy lifestyle because you can, with the fluid in the limb, you can move better. It supports the limb compression garments, and prevents injury because you're moving better. Your limb isn't as heavy, mostly for leg lymphedema, but it's less chance for falling. And it also reduces and maintains the size and shape of the limb. So it hits all of those key points for maintenance. Now, one size does not fit all with compression. There's different types of compression, and they can be used for varying reasons. And the type of compression that is needed varies with what your situation is. So at the top left of the screen, on the left, you have the circular knit, and on the right, you have the flat knit. So you can see the circular knit the weave of it, there's less of these knitted strings than there is. There's more in the flat knit. So this is a tighter weave. The circular knit garments are knit exactly that on a machine in the round, just like you would knit a sweater on circular needles. The flat knit is knitted flat on a machine back and forth, just like you would any scarf or blanket back and forth. And there's usually a seam in the flat knit garments where they join it together. Circular knit garments tend to be used for a more mild swelling. And typically you can go into a store and just sort of buy one off the shelf. This is for swelling where you have no tissue hardness or skin changes occurring. They can make circular knit garments a little stiffer by adding a few more of these knitted, I don't know what you call them, things. These are closer, the knitting is closer together. So there's a few more stitches, I guess you would say.
Tissue fibrosis and skin changes, non-uniform.
The stiffer circular knit is for more moderate swelling. They tend to be custom made, so they're fit right to your size and shape of your limb. And they're more for people who have slighter tissue changes or thicker tissue, that doughy kind of edema. They are not as stretchy as circular knit, and that's why they're called a stiffer circular knit. The flat knits are very stiff. They're meant to contain larger limb swelling, and so they're for moderate to severe swelling with tissue changes, such as the fibrosis, which is the hardening of the skin. They're also meant for non-uniform shapes. So any extra tissue that has formed and won't fit into a prefab off-the-shelf kind of thing. It needs to be custom, and it will be flat knit. They're used when a higher compression level is needed. So I need to speak to that because the compression levels are class 1, class 2, class 3. So 20 to 30, 30 to 40, 40 to 50. Sometimes we can get away with a stiffer circular knit without increasing that pressure. But sometimes when there's a lot of fluid there, these flat knits provide the most compression possible for that limb. So this garment on the right here with the silicone band here, this is one of those thick flat knit garments. And the one underneath it is more of a circular knit garment. For arms, you can get gloves, which cover the fingers, gauntlets, which only go to the base of the fingers, and arm sleeves. For chest swelling, you can get compression bras. I don't have a picture here of one of those. And those are basically your knitted garments.
You're not lucky.
There is also Velcro style garments. So Velcro style garments can be used to reduce the size of a limb or in a maintenance phase. And I'll get to those two phases in a second. So they can be used every day or on special occasions when you want to reduce the size of the limb. And they're typically used by people who cannot put on a stocking or a sleeve by themselves, or if a caregiver is putting on the stocking as well. They find it just easier to use this type of compression because compression garments are not the easiest things to put on. They come in there's a variety of different manufacturers. They can cover hand swelling, arm swelling, swelling of the foot and lower leg, or they can go right up to the thigh. And the last type of compression I'm going to talk about is something that people wear overnight. They are called night garments. Again, you can get it for any area of the body. Basically, these are worn for people who want to soften tissues overnight and help control the swelling at night. They are lighter compression than the garments that you would wear during the day, because swelling tends to go down overnight, and if the garment has too much pressure, it can cause pain. Okay, so there's three things. If you're wearing compression, there's three important things that you need to know. A lot of people are wearing compression, but it may not be the right one for them. It may not have the right compression, and they may be using it for the wrong reason. So I have come up with the 3 rights of compression to make sure and help you understand if your garment is working for you. And I have come up with this compression checklist, which I think Moise is going to provide you after this session. So basically, I'm going to quickly go over this because you can, it just tells you whether you're wearing the right garment. Is your garment right for you? So under the first section, it's questions like, what does your limb look like? Are you having a lot of cellulitis? A lot of times cellulitis can occur when the garment isn't quite stiff enough or not containing the fluid. And other questions are, do you have swelling above your garment or below? So if you were wearing just an arm sleeve, is your hand swelling? Or if you're wearing an arm sleeve and a glove, is the underneath your armpit swelling? So the next section is the right compression. So honestly, the age and fit of a garment plays a huge role in how it's going to work for you. Garments should be changed. You should get a new one anywhere between 4 and 6 months. They lose compression over time. So how do you know it's the right compression? Well, obviously, if you're wearing it on a regular basis and it's older than 6 months old, it's going to become more stretched and not as effective. If it falls down easy or you can put it on easy, then it's probably not working as well as it should anymore. If it has any holes, runs, or tears, if it's out of shape, these are key indicators that it needs to be replaced because it's not providing you with the right compression. The other thing is the right timing or the right time for compression. Now, compression can be used to reduce fluid, to get all the available fluid that can be moved at that time out of the tissues before you get into a maintenance garment. In the lymphedema world, we call this the either reduction phase, and we use bandages or sometimes the Velcro garments, depending on the situation. Not everybody can bandage themselves at home, and not everybody can afford to come and see me every day. So we decide on what the best method is for you at that time. But I also recommend to my clients that once a year that they do a reduction before they get into a new garment. And that is to prevent the progression into another stage or another phase. It keeps your limb where it is because we don't want it getting bigger. So I always suggest maybe once a year trying that out. Maintenance garments are those arm sleeves, are those leg garments. They help to maintain the limb size. They're worn daily from within about an hour of getting up until bedtime. Unless you're wearing a night garment, then you would switch to your night garment overnight. The last is lymphatic drainage massage. So nobody expects you to see a lymphedema therapist all the time for self lymphatic drainage massage. Our goal is to get you as independent as possible from us as soon as possible. So you can be taught how to do your own self lymphatic drainage massage based on your situation. No two people are alike who have had treatment for breast cancer and have lymphedema. So it's best to initially see a lymph drainage therapist who has lymphedema training to help get your personalized self-massage routine. There is pumps, intermittent pneumatic compression, called IPCs, that you can get as well. And they're very effective at improving lymphatic flow. They kind of give you the lymphatic drainage massage without the therapist doing it for you. So it's another way of doing self-massage. The research on it, there are some researchers that absolutely love this. There are some that are a bit hesitant. I think one of the major complications, if you will, is that it will bring the fluid up and out of the limb, but fluid can get stuck at the top where that pump ends. And if you're not keeping an eye on that, it can cause issues as well. So lymphatic drainage massage tends to decrease congestion, takes out the garbage from the tissues to promote the healthy skin and tissues, and it also has been shown to stimulate lymphatic flow. And we're done. So here I've given you some resources. The top left, the Complete Lymphedema Management and Nutrition Guide, was written by Jean LaMancha, who's a registered dietitian. She has a website that you can actually go to find out more about nutrition for lymphedema. But this book also has recipes in it. And it was written by a lymphedema therapist. Her name is Anne DeMena. So in the book, it goes through basically the 4 key strategies it gives you self massage routines, self bandaging routines, skincare routines. It has a very detailed skin lotion moisturizing list and tells you actually the pH of all of them. So a very helpful book. Also, the Lymphedema Association of Ontario is a charitable organization that you can that gives you resources, as well as the Canadian Lymphedema Framework. You just punch these in Google and they'll come up. But the Canadian Lymphedema Framework has a magazine, very informative, comes out with various topics. I think it's 3 or 4 times a year. They do it with the season changes, so that would be 4 times a year. But very, like this one here is an example of talking about lymphatic surgeries, which, by the way, are very hard to come by in Canada. The States is further ahead on that than we are. They're for garments. If you have been diagnosed with lymphedema, Ontario has a program, a government program called the Assistive Devices Program. There's a process for the application, but it covers 75% of the cost of the garment, which is a huge benefit for people who have lymphedema and have to buy these 3 to 4 times a year. 3 to 4 times a year. Now, when scrolling through the internet, you might come across a lot of information. This person from YouTube, Cancer Rehab PT, I don't recommend websites often or YouTube channels often, but she is a doctor of physical therapy from the States, and a lot of her videos are very helpful, and perhaps some of you have already found her. And yeah, so you can find me at Swelling Solutions. The information is there. You can get it through HopeSprings as well. And I do thank you for putting up with me for, I don't know how long I've been going, but oh my goodness, a long time. I'm so sorry. But I am finished. I'm going to stop sharing my screen.
Great. Thanks so much, Kathy, for that great presentation. So I'll just go ahead and share my screen. So we're pretty much nearing the end here. Just a few extra questions for Kathy after the presentation. So I know you've covered some of these things during your presentation, but the first question is, what are some of the first signs to look for lymphedema, and which areas are most affected? So if a patient, for example, may have lymphedema, what are some of the first initial signs that patients can look out for?
Okay, so yeah, lymphedema does go through stages. They're listed as 0 to 3. 0, of course, would be it's defined as not having any clinical symptoms, but there is some lymphatic damage. And so there would be no signs and symptoms in that phase. In stage 1 is where people start feeling a heaviness in the limb, their clothes don't fit or their jewelry don't fit the same when compared to the other side. And as the stage progresses, that's when lymphedema or edema can be seen. You can see differences between the limbs. You can see the swelling at that point. And then it progresses into areas where the swelling gets worse, the swelling doesn't go down overnight, and then the tissue changes occur. But the first signs and symptoms are that the heavy feeling, and yeah.
Okay, and which treatment or combination of treatments do you think has the most benefit for patients from the patients that you've seen in the past?
So I'm a huge advocate for using all 4, but the exercise and self-massage and compression. If you have lymphedema, those 3 work so well together.
Okay. And have you received any feedback from patients that have benefited from any kind of treatment?
So specifically for people who have the tissue changes, the harder full arms or breast, the treatment really does help to soften the tissues, and the idea is to soften the tissues for fluid, the lymph, to drain better, because it can't get through that hard tissue, so it flows better when the tissues are softened.
Okay, great. And lastly, what is the best way to reach you?
So
any questions?
Yeah, so I mean, they can Google swelling solutions, it comes up right away. My email is Kathy, CATHY, at lymphcare, LYMPHKR.com.
Great. And if you can send me your business card or any kind of information, contact information, I can maybe send it over by email. Yeah, that would be great.
Yes, for sure.
Okay, so those are all my questions. So pretty much now we've reached the end of today's sessions. Thank you so much for all those who've attended. So I'm just going to open the floor for anyone who has questions for Kathy right now.
Have I answered everything that you wanted to hear from tonight's session?
Yeah, it was very well done presentation, and you've covered more than just the basics. It was useful. Thank you very much.
Oh, you're so welcome.
Hey, really good to hear that. Any questions about Kathy's presentation or anything about lymphedema?
Hey, Kathy, it's Vicky.
Hi, Vicky.
Hi, thanks so much for the presentation. This was great. Sort of a review of what we've been doing. I've been seeing Kathy for about a year now, actually. Every 4 to 6 weeks it's been, and she's helped a ton. I had cellulitis in my breast and underarm, and I haven't had an infection there for almost the year that we've been working on this. So thank you very much.
My pleasure. That's good to hear.
Great.
Yeah. So there was somebody in the group that traveled but didn't have lymphedema. Was that Alice or Becca?
Not me.
No? Okay.
No.
All right, so I just want to touch on actually travel. If anybody plans on flying and you do not have lymphedema, there is no research to show that air travel causes lymphedema. But over the years, there's been a lot of women who have said that that's what started it. So the risk of lymphedema may be higher if you're flying because of the cabin pressures that differ. It tends to slow down lymphatic flow and increase fluid coming out of the bloodstream. So if you want to learn more about that, you can go to the National Lymphedema Network, and they have position statements. And I think, Moise, I will probably send that to you. You can send maybe as a reference for people.
Sure. Yeah. Okay, yeah. So, you know, Kathy, you can send over the material to me by email, and I'll send it over to anyone, all those who registered, and even those who may be interested in learning more about lymphedema. Yeah.
Okay.
Sure.
Yeah.
Okay. Okay. So if there's no further questions, thank you so much all again for attending, and you know, stay tuned for our next series. We do host you know, other topics related to cancer. So please look out for that, and you know, we hope to see you again in another session. Great. Okay. Take care, everyone.
Thanks. Thanks
See
for
you soon.
coming by.
Thank you.
Thank you.
Take care.
Thank you. That was very helpful.
Oh,
Great.
my pleasure. Thank you.
Thank you. Bye.
Bye.